Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over, should we be popping a blister? Okay, we can get blisters for many things, which we will discuss, but should we be popping them? So that is what we're going to be talking about today. But first, if you have not yet subscribed, please consider doing so because it does help my channel reach more people. So let's get started, guys. So blisters, we have all had them at one point in our lives, whether it's from ill-fitting shoes, a burn, or a viral infection. We have all experienced blisters, and they can be quite tempting to pop. But that's really not what we want to be doing. Our skin is our largest organ, and we want to make sure that we're keeping it intact to protect our body from infection. So once again, it is not in our best interest to be popping these pesky blisters. Okay, so as you can see here, I have three pictures. The first one would be from ill-fitted shoes. So we always want to make sure that we have good, comfortable shoes. They fit well. We're wearing socks with them. I know a lot of times, especially women with high heels, we get a new pair and we get blisters. So I will go over different ways that we can prevent them. Next picture here, I have, you can tell that this is a burn. We have the outer burn and the inner burn that got it a little bit worse here, where the blister is coming out. And then we have here, this would be from shingles, so viral infection, okay? Viral infections, autoimmune diseases can cause blisters, so we'll also go over that. So like I said, are we supposed to pop blisters? No, a big, big fat no. It's our body's way of creating a bandage to protect our body from further damage, and it will also allow the skin to heal underneath. So there is healing properties inside of that fluid to allow the skin to heal. So like I said, most cases we just leave the blister alone. It will reabsorb in the body on its own. Sometimes it will have a little break where there is a weak point and it'll drain a little bit. Perfectly fine. It's not opening it up completely where we can cause infection, okay? So sometimes blisters become extremely painful, large, and there's nothing that we can do. We need to release some of the pressure. Now, I want you to know this can lead to infection. Anytime we're opening up the tissue, it can lead to infection. So we have to be very, very, very careful doing this. And if you have an autoimmune disease, HIV, diabetes, anything that suppresses your immune system, you want to talk to a doctor about doing this, have them do it. They can use a sterile needle. But if you don't have any of those conditions, we can do this at home. We want to make sure that we have a good clean needle, and you're going to cleanse it in rubbing alcohol. Okay, I would let it sit in there with a contact time of at least 5 minutes, okay, to clean that needle. You are going to pierce the edge of the blister, okay? So see how they're coming in on the edge of the blister here? You want to poke down as close to the skin as you can into that blister. This prevents it from like opening up on the top. We just want it to kind of come out of the bottom. The pressure will kind of move the fluid down, and out of that hole, it will release some of the pressure. Now, you don't have to push on it or anything like that. Just let some of the fluid come out, and that is good enough, because a lot of times it will clot itself. Just drain some of it if that's the case. We do not want to wreck this tissue that's outside of here, okay? As much as we want, we need to keep that intact and have the smallest little hole. Just drain a little bit because this is going to protect our tissue, our skin, and prevent infection. Okay, if we start pulling at the top here or start clipping around it, it can cause infection. We do not want that. Okay, so treating a popped blister, whether it pops naturally or you've had to take a needle to the edge, you want to ensure that it heals properly and doesn't become infected. So as soon as it's open, you need to make sure that you're covering this. Now, covering it while it hasn't popped is still a great idea too, to protect it. But you want to make sure that you're protecting this from any debris, bacteria. Now see how they've left this outer tissue layer on? That is perfect. That's exactly how we want to drain a blister if we have to. Best case scenario, we leave it. Our body will just reabsorb that water, okay? But this has actually been done very, very well. And now we just want to cover it, keep the area dry, sterile bandage to promote healing, okay? So we're going to go over the 3 types of blisters. So they can result from friction. So this could be from shoes or gloves. We can also have burns, and some medical conditions also cause blisters, but we are going to talk about friction blisters first. So these are extremely common when you're wearing new shoes or you're working with your hands. Blisters can form. So what are we going to do for preventative measures? We're going to make sure that we're wearing very well fitted shoes and gloves while working with our hands. Now we want to also make sure that we're wearing breathable socks. Okay, socks are going to prevent that friction from shoes. You can also apply powder or petroleum jelly to an area of friction. Okay, now how do we treat them? So we're going to, once we have them, we're going to cover them with a loose bandage. As you can see in this picture that I've put here, you can also cut out a pad and form it into a donut that goes around the blister. So you're going to poke out the middle and have it go around the blister, and it'll give protection. Next, we have burn blisters. So if you suffer from a minor burn in the kitchen or wherever at home, you want to make sure that you're cooling down the area as fast as possible. Now, you want to use cool water, not cold water or ice, because this can further cause more damage to the tissues. So we want to put the burn under cool water for 5 minutes or until the pain stops. I would say at least 5 minutes, because a lot of times, if you've had a burn and you stick it under that cool water and you take it out, dry it off, it starts burning again. You want to make sure that you get a good 5 minutes on that. If it starts burning again, stick it back underneath the cool water. You do still need to bring the temperature down so it stops burning, because what happens is when we have a burn and that burning sensation, our skin is actually still burning because the temperature in the skin is still up high. We need to bring that down so it stops causing further damage. Okay, we do not want to pop a burn blister. Okay, so instead we're going to use a nonstick sterile bandage. Apply petroleum jelly over the area 2 to 3 times a day. Okay, avoid using ointments or other home remedies. Now, ointments from a doctor, perfectly fine. Use these, they're great. But ointments and other home remedies like toothpaste or butter can also increase the risk of infection. So you don't want to be using things like that. Petroleum jelly works just perfectly to keep it hydrated and moist, and then just put your nonstick sterile gauze over that. Now, if the burn doesn't improve or is causing you extremely severe pain, you want to contact a healthcare professional for further help. Okay, so next we have skin conditions or infections. So a lot of times, autoimmune disease, certain skin infections like impetigo, they can cause blisters on the skin, okay? This is something we never, ever, ever should pop, okay? As you can see here, we have shingles. You never pop them. We are just literally covering them. Now, like I said, under no circumstances do we pop or drain or itch these blisters. Talk with a healthcare provider about your options, okay, to managing these blistering conditions, okay? They may recommend medications, ointments, or other strategies. There's quite a few of them. So talk to your doctor specifically about what is going on with you. But once again, keeping them clean and dry, always perfect. And then your doctor can decide from there whether what the next course of treatment is for these conditions. So when should we be seeing a doctor? Okay, so most blisters, they can just be treated at home. We don't need to see a doctor. But if they're large and painful, you can always talk to your healthcare professional before draining it, especially if you're living with any conditions that are putting you higher at risk for infection, okay? Super, super cautious if you have any reason that you might get infections easier. You also want to talk to your doctor immediately if you're noticing yellow or green drainage coming from the blister, if it's hot or painful. Okay. Now, I understand when you have a burn, a fresh new burn, but this is more signs of infection. So after a day or so, and all of a sudden it's becoming hot and painful, it has red streaks, or it's developing new blisters, or it's blisters caused by a medical condition, you want to be talking to your doctor about these, okay? So I hope this video did give you a better understanding of blisters, why we get them, and how we treat them. And we try to never, ever, ever pop them. I know it can be so tempting to pop them for some people, but don't do it, okay? But that's all I have for this video, guys. I hope you did find it helpful, and I hope to catch you in my next one. Bye for now.